There are over 5 million people who die every year from injuries. Of those, over 1 million are dying because of road traffic injuries. These 1 million people mean that every day a jumbo jet aircraft is crashing. Over 360 people are dying every day from road traffic injuries around the world. I think that figure alone is plenty for world leaders to think about. Imagine if we actually heard about a jumbo jet aircraft crashing every day. You would hear about it. But you don't hear about road traffic injuries because they happen on a daily basis somewhere in a developing country. Part of the problem has been that 90% of these deaths occur in low and middle income countries. And therefore, part of our hope is that the policymakers around the world begin to pay attention to this problem that is capturing the lives of so many people, particularly because many of these people are young, productive, in the working age population. The Forum report on road traffic injury and trauma care has been approached fundamentally by using 3 principles. The first one is to make sure that our Forum report is evidence-based. So we have done a thorough review of the literature, of the scientific basis, of the evidence that is around road traffic injury prevention and control and trauma care to influence the report. Secondly, we have been in touch with some of the leading experts around the world on road traffic injury prevention and trauma care. And these experts are from the fields of health, from law, from management, from business sector, from non-governmental organizations, from Africa, from Asia, from Latin America. So we've really done a wonderful coverage of the intellectual power around the world that has been brought to this report. And finally, third, we are also using the opportunity of engaging with colleagues in the Middle Eastern region in particular and making sure that the extremely high burden of road traffic injuries that occurs in the Middle Eastern region is brought to the fore through this report. So using that trilateral approach, we hope that this report will make a very innovative contribution to global health. We are hoping that the Forum and its report will make a very significant contribution to global health, particularly global public health. We feel that the report itself has brought together not only some of the best scientific evidence, but also some of the best minds to put their ideas and thoughts together and contribute to the knowledge that we have on how to reduce the burden of road traffic injuries. Secondly, we think that it will allow us to bring this issue to the level of policymakers. We want to gain attention of policymakers around the world so that they can understand the problem and begin to see how can they address it in ways that are simple but effective, and making sure that young people don't die on the roads around the world. The World Innovation Summit for Health, or the WISH Forum, is an incredible opportunity for us in the field of road traffic injury prevention and control. And there are several reasons for that. The first reason is that the WISH Forum is providing us the intellectual base to talk about road traffic injury from both a scientific but also a practical angle. And that's the innovation, I think, that we are bringing to the table. Second, the WISH Summit itself is going to be not just a scientific meeting or a meeting of politicians, but a place where political leaders and scientists and academics and business people are all coming together to talk about a problem and how to solve it. That, we feel, is the real power of the WISH Forum. And we hope that the World Innovation Summit will allow us that space and opportunity to truly take this issue of road traffic injury prevention and trauma care and make it something that people around the world identify with. They feel that it is a problem they want to do something about, and then hopefully in the coming years have a huge impact in terms of reducing this burden around the world.